Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I am your host, Dr. Kishore Volodi, and we have a very important COVID topic to discuss today. And so that means, yes, let the crowd start to cheer. Our friend, Dr. Nowalk, is joining us today. I was telling my wife earlier today that I was recording this podcast with you. She says, "How do you pay him?" I said, "I pay him through fame. I pay him through fame." So
you know what? I'll take the fame. I'll take the fame. If there was a community that I would like to have notoriety in, it would be this one. So
I would agree. I would agree. A few years ago when the last live Down syndrome convention was here, it was so fun because this community, when you're famous within it, it is something else. So be careful walking down the streets now that we're open to that again, and we'll talk.
Bring it on. Bring it on.
Great. Well, Andy, just real briefly, tell us a little bit about yourself. Everybody kind of knows you already, but why are you so excited about COVID and Down syndrome?
Sure. So I have been a pediatrician here at UPMC Children's Hospital of Pittsburgh since 1999 when I started as a resident, and I did my pediatric training as well as my infectious disease training here. So I have a particular interest in pediatrics, but especially infectious diseases like COVID. And then my son, Peter, was born in 2006, and Peter has Down syndrome. And so over those years, I have developed a really significant interest in how infectious diseases affect both children and adults with Down syndrome along the way. So, pursuant to this, I've done some research in this area. I've done a lot of talks on it. I'm involved with the International T21RS research group, looking at attitudes and experiences with COVID in people with Down syndrome. And I'm involved in a current study with the CDC that is looking at the hospitalizations of people with Down syndrome across the United States. So, it's a topic that's near and dear to my heart in the community, and something that you and I have had the chance to talk a lot about as information has come to us over time. We started this a year ago, Kishore. I remember our first few podcasts mostly saying, I don't know. Yeah. It could be, maybe it'll be like this. And now we're in a much better place with much better information.
For sure. And people often ask, how do you know when it's time to release another COVID update? And I say it's when I get all the emails and phone calls, and we have gotten several because there's been a lot of changes over the last week or two within this country. And so I wanted to get you, before we get into the specifics of Down syndrome in general with COVID, things that have come up, just some general updates and your thoughts on things like mask-free and things that we've been hearing about. So just go ahead and just let us know, what are your thoughts on these updates?
Sure. So, I'll return to the basic thing that we've learned along the way is that when everybody masks, everybody's safe. Mm-hmm. But then we've added a new thing into that equation, which is vaccine. The COVID vaccines have turned out to be better than I ever imagined. They are rolling along at about a 95% clip at preventing symptomatic infection. So what that means, just so everybody understands, because this is an important concept, is that previously, if you took a COVID person and exposed 100 human beings to them, roughly, we would have seen, let's say, 100 infections before. Now, if we vaccinated all of those people, we'll see 5. So, I think that's important. Number one, because some people will say, well, 5 infections, the vaccine can't work that well. Well, that's one of the best vaccines we've ever had in history. That's actually as good or better than the polio vaccine, than the measles vaccine. So it's a really great vaccine at preventing symptomatic disease. And now we've learned it prevents spread of infection from the person who's infected. So if you become infected after vaccine, you tend to not have to go to the hospital. You tend not to shed very much virus, and you're very unlikely to infect anybody else. So this is wonderful. These vaccines are working incredibly well, but it's led to some changes in policy. As the US policymakers have said, we really want to encourage people to get vaccine. Recently, they said, well, folks who are vaccinated, when they're out in public or they're in some spaces, can feel better about not wearing a mask. I would say that I agree with almost all of that, but I agree mostly with we need to motivate those people listening who haven't gotten vaccinated yet to get vaccine, because that's how we're going to end this thing. But I think that there's a lot of science to suggest that the risk is dramatically reduced with vaccination. Certainly, if you're in your household and there are a lot of vaccinated people around you, you can feel completely comfortable now. Even if a case of COVID were to walk through your household, it's unlikely anybody will get infected. And as I said, even if you do get infected, you get very mild disease, which is great given the 500,000 people who've died from COVID so far. But when you're out in public, there was never much risk outside, to be completely honest. So when you're out and about and in the world, I think that you can feel very, very, very confident. In closed spaces, I will say as an ID doctor, I'm still a little more cautious because I want zero risk, not much reduced risk. But I think things are changing. And when your community has a lot of immunity because of vaccination, you can feel pretty good about going to the restaurants again. And you can feel great about the zoo and the museum and those big wide open spaces with lots of ventilation along the way. So we're moving in the right direction. And this is a reflection of it. If you look at all the case rates in the United States, they're plummeting.
And when you say that, I think it's so important for our listeners to understand it's not so much the individual benefit, which there is, as you've described, individually much less likely to get or spread this COVID disease. But if the community has a large number of people immunized, then the spread to more susceptible people will be much less. And I think that idea of it's not just, oh, I'm young, I'm not going to get it. It's more, I'm young, I don't want to spread it to anyone who could potentially be a higher risk. Is that a good way of looking at this?
That's a great way of looking at it. You know, you hear us say herd immunity, but I like to say community immunity because it rhymes, number one. Yes. But number two, it's really true. And it's like a giant game of tag. You know, early in the epidemic, we were playing a very, very bad game of tag because sometimes when someone was it, they could just look around and start tagging people and say, now you're it. And that's how it happened. Lots and lots of transmission. Now we're playing a really interesting game of tag because you have someone who's it and they turn to tag someone. And now very frequently that person says, well, actually, I'm not playing anymore. Mm-hmm. And so there are so many people who are not even playing the game that the person who's it is finding no one left to tag. So that's beautiful. Those case clusters are starting to die out on their own because they're surrounded by people who are immune. You know, sadly, 20 to 25% of people around the United States are immune because they had COVID. Mm-hmm. That's unfortunate. And that led to a lot of deaths, unfortunately. But when you take those people who have some immunity and you add them into across the country now, more than 50% of people are vaccinated with at least one dose. When we're talking about a level of community immunity that's 70 to 80% in some areas. Allegheny County, where you and I practice, has a vaccination rate that's in the mid 60% range. So if you add that 20% to 60+%, you're talking about 80, 85%, which is very close to the goal for very effective community immunity. And what are we seeing, Kishore? Our rates are plummeting rapidly.
Yeah, definitely. So it's a great, as you talk about tag, you know, when we think about kids playing tag, what a wonderful and smooth transition to the other big thing that's happened over the last week or two, which is the emergency use authorization for the Pfizer vaccine down to 12. You know, our listeners know that prior to this announcement, it was down to 16 years old that you could give vaccine to. Now it's down to 12. And we've gotten a ton of calls to the center saying, does that also include kids with Down syndrome? And so just your general thoughts on down to 12 and then in kids with Down syndrome as well.
So I think that we are very interested in vaccinating children below the age of 16 now. What we know, and when we look at rates of infection, our highest vaccinated population is above 65, which is great. They are the highest at risk. In most places around the United States, more than 80% of them are vaccinated. In our county, I'm so proud to say 97% of our above 65s are vaccinated. We have done a great job. And so we have seen the rates of disease just disappear in that population. The highest rate groups for disease now are children 0 to 18. Period. So that's where most of the infections are happening. So to get rid of those infections, we need to vaccinate those children. And you know, taking the level down to 12 is something that was based on several thousand kids who were vaccinated, and they found that it was very effective and it produced immunity that was actually better in those children than we saw in adults who were vaccinated with the same vaccine. So I think this is a really good thing. You know, this does not mean we're going to stop monitoring for side effects. And yet we have been very cautious about the rollout into kids until we've gotten a lot of data. And so our adult data is incredible. We have vaccinated more than 100 million people in the United States, more than 100 million. We're at about 150 million. And what we've found is this is an unbelievably safe vaccine. It makes a bunch of people, somewhere around 15 to 20%, feel terribly lousy for a day. And then it protects all of those people after that. So even the ones who get COVID, as I mentioned, get protection from the vaccine. It moderates disease. We are not yet fully aware, after 150 million people, of a vaccinated person who died from COVID.
Wow.
So that is different from flu. Every year we have a number of people who are influenza vaccinated who pass away from influenza. We haven't even seen that yet with COVID. So this vaccine works really well. We have a lot of incentive to vaccinate the children. And when I say incentive to vaccinate the children, I mean vaccinate the children with Down syndrome as well. What we have learned, and I talked about that at the beginning, we're smarter now than we were before. Kishore and I are teachable. It's one of the nice things about us. The data has come out, and I was uncertain about this at first. I was encouraged at first by the data I saw. But now that we've sifted through the data carefully, looking at particularly people who are hospitalized with COVID, who also have Down syndrome, they seem to be at an increased risk of serious events and death. And so that is pretty clear that when you enter the doors of the hospital, that you are at more risk if you have Down syndrome. It is not as pronounced in children because children with COVID look like children with Down syndrome look like children without Down syndrome. They don't get COVID very often. It's much more pronounced in adults, and it's still been hard for us to sort out what the relationship of long-term care facilities are to a lot of these data. But the data I've seen, and I've been part of the group that's looked at these data, is becoming more and more suggestive to me that, like almost every other respiratory illness we ever invented, COVID is more severe in people with Down syndrome. So that means we need to protect them where we can, and that means vaccine. We need to watch the vaccine very closely in children because we've seen some complications of COVID in children we want to make sure we don't see in vaccinated children. But for right now, we saw no evidence of that in the study, whereas we saw a pretty steady evidence of it in children infected with it, this MIS-C complication, which happened, at an alarming rate with some of the children who got COVID in our community. And we just have not seen that at all in vaccinated children.
So Andy, I get a lot of questions though from families saying, how can we know that it's safe in people with Down syndrome specifically if they weren't part of the studies or, with their immune differences that we know exist? How do you answer those types of questions? Were there kids with Down syndrome in these studies or adults with Down syndrome in these studies?
So there were not a ton of them in the initial studies, but now there are a ton of them in the United States because the push for vaccination led by people like you, Kishore, and folks around the community has been to include people with Down syndrome on the list of high-risk individuals. So there were not a ton of people with Down syndrome in the original studies, but now there are a ton of people with Down syndrome who have received vaccines. And I took a look at the vaccine adverse event reporting system the other day just to look, because you can search it yourself, and there's no strong signal for people with Down syndrome at all. So what we are seeing is literally thousands of people with Down syndrome have gotten vaccination in our country in the last 5 months, and we've seen no signal of them struggling with the vaccine. And we've seen that across the board. We've seen that in adults. We've seen that in young adults who've gone down to 16. So we're getting a lot of vaccine in people with Down syndrome, especially in those long-term care homes. And we've not seen a large adverse event rate. We are continuing to study this, but I want to tell you that when we vaccinate 150 million people and thousands of them have thousands of people with Down syndrome are included in them, what you need to recognize is that's a larger experience of looking at an individual vaccine in people with Down syndrome than we've ever had with any vaccine before in history. So we are gathering these data on people with Down syndrome. I have to tell you, as a scientist who studies vaccines, we don't know nearly as much in terms of numbers about people with Down syndrome for any vaccine. When Kishore and I throw back data about flu vaccine or the pneumococcal vaccine, we talk about this study with 10 people, this study with 100 people, this study with 200 people. Those are the numbers we're talking about from before. Now with COVID vaccine, thousands of people with Down syndrome have gotten it, and there's been no signal for a significant adverse effect. So when people say to me, well, there's no evidence, I turn around and say, 5 months ago, there wasn't. You're correct. We didn't have a strong evidence base. Now we have more evidence about this vaccine with people with Down syndrome than we've ever had before. And, we're going to gather more evidence. We're going to look at these folks and we're going to look at our clinics and our populations over time. But the early results are very promising.
Yeah, that's great. So I'm getting it loud and clear, and I'm going to say it loud and clear too. Would definitely recommend for children down to 12, whether they have Down syndrome or not, that getting the vaccine is what they should be doing right now.
And that's just what I had my 15-year-old son, Peter, do on Friday last week. He
Wonderful.
received the Pfizer vaccine. My wife and I discussed it. And, this is an important thing. A lot of folks are looking at vaccine data and seeing in the same family where parents and young adults are all getting vaccinated, they are nervous about vaccinating their children. And I think that's great. I want to state that for the record. I think that's great. Good parents ask us why we're doing what we're doing. And then they say to us, Dr. Nowalk, Dr. Velody, show me the evidence. How do we know that this is going to help my child? So I embrace that. That's good parents in the United States saying, I want to be sure. And we're gathering that evidence very actively. My wife and I talked about it, and she asked me the same questions because she's a good mom. And I gave her the data, and she said, I think this sounds like we should definitely get it for him. Yeah. So we went ahead and vaccinated my son. I would feel confident recommending it to anybody in our community. And to give you a preview of this, we are now vaccinating actively our patients in our community with solid organ transplants. So if you're looking at patients with problems with their immune system, they are a key group. They are tolerating this vaccine very well. They're not producing the level of immunity we'd like, but they're producing some, which is incredible because they're on immunosuppressive medications. So we have a lot of populations that should be at very high risk that we vaccinated that are doing well with the vaccine. And I expect our Down syndrome community to benefit from this too. And if there is any concern that comes up, if Dr. Velody and I see any data, you can be sure all of these national and international groups that support people with Down syndrome are going to talk about it and let you know about that immediately. We try to share information as rapidly as we can, and we're always going to be honest because we want our community to be healthy.
I agree. Yeah, my 46-year-old brother is now considered fully vaccinated as of March and went back to work recently, and the joy that he has to be able to be a contributing member to society again. We talk about the medical benefits of getting vaccinated, but just the psychological benefits that way, I think are important to remember. Yes, and they always say it's when doctors talk about how they're vaccinating their own kids. All of mine are teenagers now, and they are all either vaccinated or scheduled to be vaccinated within the week. And so this is a great time in our ability to potentially see an end to this pandemic, at least here within this country, hopefully worldwide in the coming months to years.
Yeah, I agree. Completely agree.
Yeah. Well, great. Well, Dr. Nowalk, thank you so much, as always, for joining us on this podcast.
Welcome.
Your check is not in the mail. And we will look forward to the next time when there's another update for us to share. Hopefully more good news like this podcast was able to bring to our listeners. To you, our listener, as you always know, reach out to us. Any questions that you have, and specifically if it's COVID related, I know where to go to for that type of information to get it out to you. But any topic at all, Down Syndrome Center at chp.edu. And until next time, bye-bye.